Dr. Keith Smithson, Northern Virginia Doctor of Optometry. We're going to talk a little bit about computer vision syndrome. What is computer vision syndrome? Is it a real thing? Well, it's one of the things that we've talked about probably more often than just about anything during this COVID-19 epidemic. The amount of people that have called our office complaining about tired eyes, fatigue, eye strain, eye pain, headaches. And what is the one thing that a lot of these people have in common is this increase in workload at near focus. Whether it be on a tablet, on a digital device, on a computer screen, something where we're doing a lot of remote working, a lot of teleworking. Again, something that's been pretty relevant in our area for a long, long time, but certainly something that people are doing at a greater intensity. So what is computer vision syndrome? Well, it relates to almost, two things if we really want to break it down. One is the physical component that's required for eye focusing at near. If we think about muscular focus in the rest of the body, there's this kind of flexing and relaxing of muscles that we're all familiar with. Well, the way that the eye muscles work, they flex, they contract as we look at close targets, and they relax as we look at distance targets. So think about that muscular component, the effort and the strain that's involved in trying to pull the eyes into a near focus. And if we do that for extended periods of time, having almost a muscle spasm where we're losing that outward, that distance focus. And generally in a day-to-day office environment, we may look back and forth quite a bit to kind of keep that muscle flexibility. But in today's world of locking into digital devices for a long time, especially for our youth and students that are now being asked to do remote learning, a lot of close vision focus that leads to that muscular spasm. The other thing that's truly important as we talk about computer vision syndrome is the wavelength of light that's emitted off digital devices. So there's a specific wavelength of light that we talk about and call blue light that falls below the colored spectrum, below the blue that we actually see in the rainbow and in the everyday world. This is a short wavelength damaging light. Think about it like UV. We've talked about UV for a long time and how UV protection is important. Wear sunglasses to prevent, UV related problems like cataracts. Well, we have this now blue light that comes off the digital devices in pretty high intensities. It's what makes your iPads look that really brilliant white. So that can also lead to the strain components of computer vision syndrome. What do people feel when they have computer vision syndrome? They feel fatigue, they feel strained, they feel tired at the end of the day. We know that it impacts things like your melatonin levels, your sleep patterns. If you do it long in the day or late in the day, can impact your restlessness trying to sleep, your real extended sleep patterns can really be impacted if we have too much blue light in our system, especially at the end of the day. Okay, so all of these things become really new for sometimes patients that haven't done a lot of close vision focus. And so that eye strain component, that blue light component are things that are truly real and things that truly go together in computer vision syndrome. If you think this might sound like you, come see us in any of our 5 locations with any of our docs. They're happy to sit you down, talk you through this a little bit more, do the comprehensive testing that we need to evaluate whether or not this is something that you're experiencing, and then talk you through therapeutic options. What are those therapeutic options? If you have computer vision syndrome, what can we do about it? Well, one thing we can do about it is we can talk about refractive tools. We can talk about computer glasses, the ability to put on a lens that has something, either a prescription related to the physical part of that, the muscular strain of that, certainly a blue blocking filter that's in the lens. It doesn't have to look yellow or goofy, can be completely clear like the lenses I'm wearing and still be blocking those blue wavelengths of light. So again, can be done with or without a prescription to at least manage the blue light component to computer vision syndrome. We can do photochromic lenses. Photochromic lenses, again, can change color light to dark to become a sunglass outside, but in the indoor lighting environment, they are a blue blocking filter as well. The other thing that's quite new for us in this world is blue blocking contact lenses. The AccuView Oasis with Transitions is a light adapting contact lens that does have blue filtering effects indoor. So if you're a contact lens wearer, you can wear now contact lenses to help with blue blocking. So we put this all together, and it's a way for us to really feel better in our new normal of extended computer vision focus. The last thing we can do is potentially muscular training, physical training. If your eyes are truly in that muscular spasm, think about it like going to the gym, doing a big workout. You go in, you do some strength, you do some flexibility. We have what we call vision therapy, sort of our version of physical therapy, that can be done in the right situations if, again, you are someone who has that true muscular spasm or muscular weakness that's manifesting during this computer vision syndrome. We would potentially prescribe a physical therapy regimen that can be helpful as well. So all these different components can be really helpful when we're dealing with computer vision syndrome. It's a real thing. It can certainly create problems, and certainly ask us to see if it's right for you. The other facet of blue light is the physical damage potential of blue light. So we've talked about the ultraviolet protection issue. We've talked about protecting the eyes from UV. Well, when we have intensity of blue light, we know from studies it can actually damage physical cells in the back of the eye. You've heard about things like macular degeneration with the central part of the eye, in the back of the eye, the retina, becoming damaged over time. And again, some of this is unexplainable. Some of it's genetically linked. But we have studies that say that intense levels of blue light can actually damage the macula. So if you have macular degeneration in your family, or you want to be proactive, or again, we want to have that same effective UV protection outside with a sunglass, we know we're going to sit in front of a digital device for a long period of time. Make sure you're using that blue blocking filter to help protect this central part of the eye called the macula. One great rule of thumb before you come to see us at the Northern Virginia Doctors of Optometry is the 20-20-20 rule, something that takes into account everything we just talked about with computer vision syndrome, the muscular component, the blue blocking, the potential damage to the back of the eye. So something very simple that is what we call visual hygiene issue. So if we are going to sit in front of a computer for a long period of time, we'll say 20 minutes. Every 20 minutes that you're in front of a digital device, you should look 20 feet away for 20 seconds. So think about that again, and keeping those muscles flexible, keeping your eyes with a little bit of almost a workout, and keeping them at their best during your extended computer work. Come to see us anytime. Reach out to us at any of our locations. We're happy to do these assessments and look at, again, whether or not computer vision syndrome is something that needs to be managed in your life. Dr. Keith Smithson, Northern Virginia Doctors of Optometry.